In regional anaesthesia, one of the major concerns is a nerve injury, and I've always been a proponent of using hydro-dissection. In other words, you inject, you create a potential space, and then move your needle into that space. This has been shown to reduce the potential for needle nerve contact, and this is exactly when nerve injury may occur. I think it's very, very unlikely that you'll be able to introduce a needle into a nerve if there's local anaesthetic coming out of the needle tip. This is one technique that I've always liked to do and that I teach. In the past, with hydro-dissection technique, you might use a bit of extra volume because, again, your assistant might be inconsistent in how quickly they inject. And this is maybe one of the biggest advantages, is that the SAFIRA pressure and the injection rate is very well controlled. You then actually end up using a lot less local anaesthetic, and you can still manipulate the needle around the nerve and on the local anaesthetic deposition around the nerve, giving you the perfect block. I was surprised in the first, I'd say 10 blocks that I did, that I probably used about a third less local anaesthetic than I would have used, because normally you would, when you look for block success, I look at how the local anaesthetic is actually surrounding the nerve. And with an assistant injecting, you would normally get 10 mils or 20 mils. With the SAFIRA system, often, as I say, a third less, and you're thinking, well, where should I put the rest of the local anaesthetic? I've achieved my goal, and the nerve was nicely surrounded. So from that point of view, that was a pleasant surprise. And obviously, in fascial plane blocks, especially if you have to do multiple blocks, local anaesthetic toxicity might eventually come into it. So I think it's important that the lowest volume is used for achieving block success.